Venezuela's strongest earthquake in more than a century has struck at a time when the country was only beginning to stabilize after years of economic turmoil. The economy has contracted by nearly 80% since 2013, weighed down by sanctions, hyperinflation, corruption, and chronic underinvestment. Although recent easing of U.S. sanctions had helped lift oil production to nearly 1.2 million barrels per day, inflation remains elevated and shortages of essential goods continue. With nearly one-third of the population already dependent on humanitarian assistance, the earthquake threatens to deepen an already severe economic and social crisis. The disaster is expected to place enormous pressure on Venezuela's weak infrastructure and public services. According to early U.S. Geological Survey estimates, economic losses could range between $10 and $100 billion, potentially matching the country's entire annual economic output. Hospitals, electricity networks, and water systems, weakened by years of underinvestment, now face an unprecedented challenge. While major oil production and refining facilities have largely escaped structural damage, widespread power outages across several central states have raised concerns over whether production can be maintained. Acting President Delcy Rodriguez has declared a state of emergency, mobilizing the country's public and private healthcare systems and launching large-scale search and rescue operations. The United States has pledged humanitarian assistance, including rescue teams and medical support. However, rebuilding will require billions of dollars at a time when public finances remain under severe strain. According to insurance broker WION, insured losses, those are expected to account for only a small fraction of the total damage because insurance penetration in Venezuela remains extremely low. That means much of the financial burden of reconstruction is likely to fall on the government, businesses, and affected communities, making the country's economic recovery even more challenging.